Welcome to an in-depth exploration of bladder disorders, a group of conditions that significantly impact the urinary system and overall quality of life. In this video, we'll navigate through the complexities of bladder disorders, covering their causes, how they affect the body, who is most at risk, and what can be done to manage and prevent them. Join us as we unravel the science behind these common, yet often misunderstood, health issues. So, what triggers these bladder problems? The causes are varied and can stem from infections, such as cystitis, which is particularly common in women. Neurological issues like multiple sclerosis or spinal cord injuries can disrupt the bladder's ability to function correctly. Obstructions, like an enlarged prostate in men, can block urine flow and lead to bladder dysfunction. Certain medications can also have side effects that impact bladder control. And sometimes, the exact cause remains elusive, falling under the category of idiopathic bladder disorders. To understand bladder disorders, we need to look at the pathophysiology, how these conditions affect the bladder's normal function. Imagine the bladder as a muscular sac responsible for storing urine. In a healthy bladder, muscles contract and relax in a coordinated manner, allowing for controlled urination. But in bladder disorders, this process is disrupted. For example, overactive bladder involves involuntary bladder muscle contractions, leading to urgency and frequent urination. On the other hand, urinary retention occurs when the bladder is unable to empty completely, often due to a blockage or nerve damage. Understanding these disruptions is key to managing the symptoms effectively. Bladder disorders are more common than you might think, and their prevalence varies depending on the specific condition. Urinary tract infections, or UTIs, are especially among women. Overactive bladder affects millions of adults worldwide, and its incidence increases with age. Benign prostatic hyperplasia, or BPH, leading to bladder outlet obstruction, is highly prevalent in older men. Factors like age, gender, genetics, and lifestyle can all influence the likelihood of developing a bladder disorder. Recognizing the signs and symptoms is crucial for early diagnosis and treatment. Common symptoms include frequent urination, often more than 8 times a day, and urgency, the sudden and compelling need to urinate. Other symptoms may include nocturia, or nighttime urination, painful urination, also known as dysuria, incontinence, or the involuntary loss of urine, and difficulty starting or stopping urination. Keep in mind that symptoms can vary significantly depending on the specific bladder disorder and its severity. Diagnosing bladder disorders typically involves a thorough medical history, physical examination, and various diagnostic tests. A urine analysis can detect infections or other abnormalities. A bladder diary, where you track your fluid intake and urination patterns, can provide valuable insights. Aerodynamic testing measures bladder function, including bladder capacity, pressure, and flow rate. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows for direct visualization of the bladder lining. Bladder disorders encompass a spectrum of conditions. Overactive bladder, or OAB, is characterized by urinary frequency, urgency, and urge incontinence. Urinary incontinence can further be divided into stress incontinence, urge incontinence, overflow incontinence, and functional incontinence. Urinary retention can be acute or chronic. Interstitial cystitis, or bladder pain syndrome, is a chronic condition characterized by bladder pain and urinary symptoms. Bladder cancer, while less common, is a serious condition that requires prompt diagnosis and treatment. Treatment and management strategies for bladder disorders are tailored to the specific condition and its severity. Lifestyle modifications, such as dietary changes, fluid management, and bladder training, are often the first line of defense. Medications, like anticholinergics for overactive bladder or alpha blockers for urinary retention due to BPH, can help manage symptoms. Medical devices such as catheters for urinary retention or pessaries for stress incontinence may be necessary. In some cases, surgery, such as bladder augmentation for overactive bladder or transurethral resection of the prostate, or 2RP for BPH, may be considered. While not all bladder disorders are preventable, there are several steps you can take to reduce your risk. Staying hydrated by drinking plenty of water can help prevent urinary tract infections. Practicing good hygiene, such as wiping front to back after using the toilet, can also minimize the risk of UTIs. Maintaining a healthy weight and exercising regularly can improve overall bladder health. Avoiding bladder irritants, such as caffeine and alcohol, can help manage symptoms of overactive bladder. For men, regular prostate screenings can help detect and manage BPH early. The prognosis for bladder disorders varies widely depending on the specific condition. Many bladder disorders can be effectively managed with lifestyle modifications, medications, and other treatments. Research into bladder disorders is ongoing, with a focus on developing new and more effective treatments. Gene therapy and stem cell therapy are showing promise in treating certain bladder disorders. Advances in imaging techniques are improving our ability to diagnose and monitor bladder conditions. The ultimate goal is to improve the quality of life for individuals affected by bladder disorders and restore optimal bladder function.